Hello, everybody. Thank you so much for joining us in this webinar. We're going to be interviewing Dr. Amy Mechley. She's practicing direct primary care, family, and lifestyle medicine physician, entrepreneur, clinical consultant, and educator. And she is part of the American College of Lifestyle Medicine. So Dr. Mechley, thank you so much for being here with us.
It is my pleasure. Absolutely.
Thank you. Okay, so this will be a bit of a conversation between us, a bit kind of like a podcast style, I guess, interview. So I will be giving I'll be asking a set of questions, and Dr. Mechley will be answering, and then we will go into a bit of discussion. You guys can put in your questions in the chat, and at the end we'll have a Q&A session, more particularly with Dr. Mechley, to talk about more specific subjects. Okay. So the first question that I have for you is, how did you first get into lifestyle medicine?
Yes. So you'll see that most of us in lifestyle medicine have a personal story. Sometimes there's a trigger. I think I was practicing. So I've been a doctor here in the United States for 24 years. And again, first, hello to everyone. And my apologies. I would love to be able to speak in your native language. I know some Spanish, but it is in no way conversational. So well, maybe one day, because I'm still a student, I'm still learning more and more, but hopefully my English is well, adequate, and I don't use too many colloquialisms. But so back in 2008, 2009, I was a practicing physician and just felt frustrated, like I think many of us feel, that I was in the clinic or in the office with a lot of patients, but I felt like I wasn't getting to the heart of the matter, wasn't really getting to what we call the foundation of health, just trying to see a lot of patients and do the best that I could. My brother-in-law passed away at a very young age of heart disease, and he was a relatively healthy person. And that was the end all be all. I said, that's it. I've got to figure out what else is going on, especially when it comes to heart disease. That was one of the pulls, because he died of a heart attack at age 45. And it hit our family very hard. So I started to look into some different types of medicine. Mind-body medicine is what drew me in. That was what was happening back in the early 2000s that caught my attention. So I went to some classes at Harvard and went to the Henry Benson Institute. And I came back and I started something called the Richardson Mind-Body Institute, which was my version of lifestyle medicine, but I didn't call it lifestyle medicine then. And I took people through a 12-week course, an intensive course, because I really felt like at the time I didn't have the tools and the ability or the training to do it on a day-to-day basis, but I knew how to do it after hours. So that's how I started. I ran my own program for about 3 years, had some great outcomes, went to a large healthcare system and said, this is working. Is anyone interested? Well, of the 5 healthcare systems, there was only one. And then I leaned in there, and after a while they hired me to be the director of the wellness division, started the division, was doing a lot of corporate health that way. And at every point during that journey, I would still be doing something a little bit on my own and my own teaching. And then I was early on, when ACLM formed, was one of the earlier attendees, because I was trying to figure out what this thing was called. And we'll talk about that, I think, a little bit, Laura, about the differences between some of the modalities that we have now that can help us practice a deeper and more meaningful primary care. So I stayed with my primary care practice. I'm still a full-time primary care physician, and then just brought in the things that I've learned from lifestyle medicine. And in the beginning was doing my own thing, and then continued with my education mainly through ACLM, and then became board certified, and now fully practice lifestyle medicine integrated with my primary care is how I practice it here in my office.
Okay, that's an incredible journey. Thank you so much for sharing. Definitely lifestyle medicine complements, I would say, pretty much all specialties in medicine. So what were the biggest challenges that you faced while adopting a lifestyle medicine practice?
I think it was communicating to people what that meant. So it was, what is lifestyle medicine? Is it some other trend, some other, wellness thing? Because wellness was a really important word probably back in the early 2000s, and it became very, a very generic term that everybody was like, oh, wellness, what does wellness really mean? And it became a marketing term. So lifestyle medicine, I think the biggest thing is to help patients, but not only patients, but all of our stakeholders. You know, the people are paying for us to do what we do and the outcomes, and as well as my partners. You know, different physicians. They're like, you know, is this some kind of acupuncture? What are you trying to, you know? And so I think, again, it's the communication was the biggest thing for the people around me, because I knew what I was doing was the foundation of good medical care. We talk about guidelines, and here in the United States, you know, we have the JNC7 guidelines. You guys have your medical bodies that say, here's the most appropriate way of taking care of fill in the blank, cardiovascular care, et cetera. And all of them start with lifestyle medicine. You need a lifestyle medicine intervention before you do anything else. And I'm thinking, we're really not doing that. So it's to really normalize and help people understand that what we're doing is evidence-based foundational care that really changes the outcome. It truly affects the most important part of our practice and our patients' outcomes.
Yeah, and I love that you mentioned that it's evidence-based. And I think that is one of the things that really differentiates lifestyle medicine from other so-called alternative medical practices. Just asking this kind of like question up near, like, what do you think is, in what ways does lifestyle medicine have kind of like an upper hand to other types of medicine, for example, functional medicine, or even integrative medicine, or Ayurveda, or some other kind of like medical practices?
No, it's a great question. We get that a lot. So when I was the medical director of the wellness division for a large healthcare system here, I went and did a lot of exploratory research to understand that exact question. What is it that sets lifestyle medicine apart? And in the beginning, is lifestyle medicine really what I'm actually practicing? Or is it, like, I think a lot of physicians and healthcare practitioners look around saying, what makes sense to me? And as a professional, we are held to these standards. When somebody comes in and says, you're a physician and I trust you, I'm like, absolutely, that trust is well placed, because I'm not going to all of a sudden say, hey, let's try this. It's not proven, or let's do something that I think may or may not be harmful, or and harmful to you, not only maybe physiologically, but financially, or an emotional. Like, I've got your hopes up and I'm selling you this whole bill of goods that may or may not really be proven. So I think what lifestyle medicine came to mean, or does mean to me, is that it is a modality that not only you're doing all three. You can use it for prevention, treatment, and the thing that still blows my mind away, reversal. That is the greatest joy I have with my patients, when we can say we are actually stopping a medication or you now no longer have. And that doesn't always happen, but boy, is that powerful. That is just amazing. And we see that in lifestyle medicine over and over. Lifestyle medicine also differentiates itself in that we're walking with the patient. I am not prescribing something and saying, you do this, you do this. I'm saying to the patient, let me hear and understand more about you. Let me hear and understand where you're at, and let me meet you where you're at. And you are going to take these steps, and I'm going to guide you. And I think, again, we get a lot. My name of my practice is Integrated Family Care. So we get a lot of questions like, oh, are you integrative? And that has a connotation, as you know. But we're integrated because we integrate with the rest of your whole life. It's a very holistic perspective. But I think it is very different. I think, the whole foods, plant strong focus, as opposed to supplements, which the science really isn't completely there with supplements. We do know that you take a supplement, you can say it's in your blood, but is it at the cellular level? And are we really seeing the changes that eating a tomato would mean if you're taking lycopene supplements for your brain? Eating the tomato, the pH makes a difference. That's why, I think it was created that way. So I think there's just such a strong, scientifically sound background to what we practice in lifestyle medicine. It's not sexy, as Michael Greger says. There's not a lot of sexiness about broccoli, but boy, is it awesome when it comes to, doing the work that we're doing. So I think there's a few different modalities, and what I try to also explain is what we have in common. If you look at some of those modalities, there's a lot that are in common. We're all looking for most of those modalities talk about a good, sound nutrition. So something that is actually nutritious, real food, eating real food, sleep, self-care. So there's a lot that we have in common with those, but I think the differentiating is how we approach it as a profession and a professional, and that we're really looking at evidence-guided information. And that evidence is different because, as you know, we talk about, the randomized controlled trials. I was a university professor for years, and we would pick apart these studies and trying to understand what is really good science. And there's a lot out there right now that are in journals that are just not sound. So I think we have to keep our eyes wide open from that perspective. What is industry sponsored and where people are bringing some of this, and I put the science forward, but also keeping our eyes on things that are harder to prove. Like we do know acupuncture works well for certain things, but it's not an end all be all for everything. And we do know that massage and myofascial release is really great for certain things where other modalities aren't as helpful. So I think it's again, keeping a very critical eye on many ways of understanding the science, being open to it, but yet saying, this is, I feel, as a professional, I've done the research, I understand. And that's one of the reasons I wanted to get credentialed. I really wanted to make sure that I had access to the most rigorous information around this, and that I put the time in to study it. Because a lot of people are like, oh yeah, I do that too. I'm like, yeah, I get it. You do lifestyle medicine too, because you talk to people about nutrition, which is great. And you talk to people, but you might not have the best evidence about, what's really going on or the most up-to-date information.
Yeah, I completely agree with that. It's that I feel like lifestyle medicine can be used a bit loosely, and there's a lot of so-called lifestyle medicine practitioners, but that aren't actually certified. And one of the things that I find is most helpful about the International Board and American Board certification is that in lifestyle medicine is that it's universal. Whether you get certified in Mexico or in the US or in China, it's going to be exactly the same standardized practices. So you don't really have to, whether you go to a doctor in pretty much any part of the world, if they're certified, they take the same exams, the same questions, same material. So I find that it's very comforting as a patient that you know that the person that you're going to, the doctor that you're going to, is going to know exactly, how to treat you using lifestyle, and not just make some recommendations here and there with nutrition and exercise, which are just mostly blanket recommendations that just, exercise more and eat more fruits and vegetables. It's like, it's not actually prescribing these things as they should. In lifestyle medicine, you prescribe nutrition, you prescribe exercise and social connection and all these things. And how have you been integrating that into your practice?
Well, Laura, I think you hit on a really important point too around the certification. It's not just the knowledge. I say that we talk about this all the time. Knowledge is here. And if it was just knowledge, healthcare practitioners in general would be the healthiest people around, and we're not in general. So if it's just understanding the knowledge, it's not the knowledge, it's the information, but it's the behavior. And I always say we play on this bridge between knowledge and behavior, because then we help incorporate it into a regular part of your life. And that's what's key. And again, you're doing it. We bring the knowledge, but we also bring how do you engage patients? How do you connect with them? How do you, this thing out going, you need to lose more weight, you need to exercise. Oh, thanks, doc. Yeah, that's really going to happen. Not going to happen. So it's, where are you? How do we meet you where you are? How do we talk about these critical conversations about obesity and weight when it's obvious that, somebody's obese and overweight, but we have to talk about it. And how do we approach that and say, where are you with that? And how might we take you to the next level? I had so many great patient interactions today. That's why I was running over. Laura May was very nervous because I was, fitting this in, and I, of course, fit one more patient in, but wonderful conversations with patients. And they're like, wow, no doctor has ever talked to me like that or ever listened. I think skilled listening is a part of lifestyle medicine. So again, it's not just knowing what the gut microbiome is, but what does that mean? It's like, I always tell people, I've got all this knowledge back here, and I've got to discern what's real knowledge and what's really good. Then I got to take it and I got to say, what is it to the patient who's sitting right in front of me right now? And that's that personalized medicine approach that's really important. I can't have the same message go to every single one of my patients, even if it's about the same subject. And getting certified and being in the College of Lifestyle Medicine or around those skilled practitioners, you pick up on that and you say, here's how we create an environment and a conversation that helps people move and shift, which is important.
Yeah, I love that. I think that the practitioner and patient relationship is is pretty much key it's a key aspect of lifestyle medicine. And why do you think that implementing these lifestyle medicine programs is vital, and how can they impact medical education and patient outcomes? Like, what have you seen in the US? In Mexico, lifestyle medicine is just starting, but it's been around for quite a while in the US. And what have you seen about implementing these types of programs?
Well, it's super exciting. And I get so pumped up because, as you said before, it's global. It's global. We're all one person. We're all human beings. We're all same flesh, same blood. I always love looking at that as you as a doctor, as a healthcare professional, if you cut somebody open, the blood's the same color, and it runs the same. Now, at the same time, like just what I said, the person sitting in front of me is very different than the person who was just here before. So we're all individuals, but this, understanding the impact that this can have globally is just massive. So I'm thrilled Mexico is at this early toddler stage, and growing and really understanding and embracing that. And please learn from all. I always say, best practices. What have we done well? What have we, are still looking at? But standing on the shoulders. I always talk about, as we learn, we stand on the shoulders of others to get even higher. But as far as is what the why are they vital? It's sort of what we touched on before. It is the underpinning of every aspect of health. These 6 pillars of lifestyle medicine. If we ignore them, it's what we have. Classically right now in the United States is this unsustainable, out of control spend of healthcare, where people are sicker and living longer, maybe, but not living not well fulfilled, but happy lives. I mean, so many of my patients, when they come in, and they might be a little resistant, like, doc, I'm not going to do that, And I just gotta stop and I say, are you happy? I'm not happy. I'm like, okay, then let's talk about that. Because if you're happy and you're completely content and you're not suffering, super. But that's not what's happening here in the United States. The majority of people don't feel well. They're not thriving. They're not having that vitality that they want. So that's the impact is just so significant, so huge. And you touched, Laura, on the education part. That is one of the main core ACLM pushes, is to really fill that gap of education that we're not getting in our medical education or our ongoing education in any healthcare field. Of bringing that science of understanding of what lifestyle medicine is and the impact. And if we can do that at every level, then the immersion of this knowledge and this behavior is going to hit so many. And that's what we really want. We don't want to have just 10 super duper specialists that you have to wait, a year to get in to see, et cetera. This is solid, excellent care that everyone around the world can give. Yeah. And the impact is huge.
I love that. Yeah, I love that the impact and the fact that it doesn't really, I've heard a lot, we were talking about the differences between other specialties, and not specialties, but other areas of medicine, like functional medicine. And something that I hear quite a lot is that people that go to a functional medicine practitioner, what happens is they get out of the appointment with the doctor or the healthcare practitioner. And what happens is they get like a huge amount of supplements that they have to take, and like so many blood tests and all these things. And it ends up adding up pretty quickly. So people basically have to shell out a lot of money in order to get to be in functional medicine in a way. I'm not saying that supplements are not, as we mentioned, like some of them are helpful, but really, I feel like what lifestyle medicine is more of economic approach. Tell us a little bit more about that.
Well, it's like the health equity line, that we're really pushing on. This should be available to all people. And if it costs way too much, just like, certain medications and pharma, if you need it and it costs too much, you're not going to take it. So really understanding what we're here for and how we're here to improve the health of hopefully anyone we meet. Lifestyle medicine is brilliant. It makes the most sense. It's accessible to everyone. It can be practiced by every health practitioner who's well trained, and in a sustainable, consistent way, like you talked about, that it's standardized. And so it's meaningful. We're at a level that it's very meaningful. It's not just, oh, I'm an influencer here, I'm going to try this, try this, try this. No, we are professionals. We need to be held to a standard and practice in that way that we know that's appropriate for those and for the for the outcomes of all the people that we are around. So no, and I agree. I mean, I have a very close friend who's a functional medicine doctor here. We practiced together. We were actually job partners in a conventional medical practice probably 17, 18 years ago. She practices functional medicine here. She's a lovely person and she's a really smart doctor. And I do send a few patients to her who really want that approach if they're looking for that. But it's very similar to what you said. It's unfortunately at a very high price point, and there are a lot of interventions that have to do with supplements. And to the point that, again, this is from my research and my opinion, that has not been scientifically sound or proven. Science, it's really easy. Science is not logical. That's the frustration we have. We're reductionist thinkers as human beings. We want to say, what is the one thing I can do that'll make, there is no one thing. There's 1,000 different processes and 10 to thousands of different hormones talking at the same time. So I always say our body is like a river. You never step in the river twice. You never step in the same river twice, because if you step in it a few minutes later, the river has already changed. Our body is just constantly changing. There's so many processes going on. So we can't reduce it to just one thing. And we want to do that. And so we want to say, I want to find that one thing that's going to make me feel better. And as we know, there's just all these beautiful, wonderful things happening at one time. And I think sometimes in that, in some of those other modalities, they want to come up with, here's the one thing, or here's the big thing. And when you say like vitamin D is really important. Completely agree. If you look at the science of vitamin D, really know, like, let's say less than 12 is detrimental, 12 to 20, 20 to 30 is pretty good. So we say, oh, based upon the kind of science and population-based health, we're thinking above 30 is good. Why have functional medicine practitioners in the area? They're like, oh, no, 70, you have to be a 70 and above. Where's the science? It's not, they think, well, this is here. So logically it would be this. Science is not always logical. You have to kind of understand that. I did OB for the first 8 years of my practice, delivering babies. I was on faculty. So I did OB as part of that. And it was right after that when they found out that monitoring babies during labor was actually not improving the outcome. And I just blew my mind, because I'm like, no, that's still standard care. Well, guess what? We're still doing it. They're still doing it, but it actually, scientifically, you'd think it would be, but it actually increases C-section rates and increases some other issues. So science is not always logical. You have to prove it through that scientific method. And I think that's what we hold to the greatest degree that we can. And some other areas is just, it's just not there yet. And we can't make some of those leaps without really understanding it.
Yeah, definitely. I feel like you have to look at the whole picture and not just one study or one thing that could be influencing. And also what you mentioned, that some studies can be influenced by industry and can be funded by certain different, individuals or corporations that have specific interests. So I think that you can basically prove anything under the sun with one study. I mean, I'm pretty sure that there's a study proving that pretty much anything is beneficial for you if you study it in a particular way. And I feel like the way that a study is organized and what you're measuring and the subjects, there's just so many things. But I feel like if you just take a look at epidemiology, and you just take a look at the populations that are living the longest, like blue zones, like you don't need a triple blind placebo-controlled trial to prove that, they're living healthy lives. Why? Because they're embodying lifestyle medicine. They're having these meaningful connections, and they're eating locally grown foods, mostly plants. So yeah, it's all definitely, there's a conflicts of interest in science right now, and we just have to know where to choose.
Well, I think we need to be thoughtful about that. And we need to be thinking, okay, who's giving us information and what does it pertain? But it's beautiful when some things are certainly simple. And then you see this is, there's meaning in relationships. And that's what I think about nutrition. Nutrition can get so controversial. We can get really picky, but the majority of us all agree a plant strong, whole foods, strong nutrition plan nourishes the body and is optimal for most people. It doesn't mean not this plus this, not this. In general, that's why we could pick on this, but let's just all I say just crowd it out. Let's bring more in, just keep bringing more in, as opposed to, other small details, which, can be important. There's certain room for that we have to keep looking at that. But in general, we give the public a strong message about that.
Yeah, definitely. I think that it's the science is pretty sound in that whole food plant-based nutrition, at least in the majority, like these blue zones are eating over 90% of their calories from plants. And it's not so much about ideology and, food has gotten so politicized, I feel, lately. And it's like, what, are you vegan or keto or, and there's even within the plant-based world, like plant-based versus vegan, like there's just so many arguments. And I feel like that's just driving us away from the fact that, the science is pretty clear on Plant Strong. And that's one of the keys of lifestyle medicine. It's just like prescribing more plants and not so much about restricting.
Yeah. Or let's even take something less controversial, like movement and exercise.
Mm-hmm. Yeah.
There's so much we really understand about that. Let's get that message out there. Let's explore that message. Let's really kind of say, yes, sitting all day is going to cause issues. And I know that's our culture right now. That's where we're at. So how might we, get up and move around more, creating cultures, creating environments that, are helpful for that. Sleep is a huge one,
Mm-hmm.
So there's so much about all of our messages that I think are just so absolutely valid and important that most interactions with the medical community don't speak of. And it's like, wow, but we're prescribing the heck out of a bunch of stuff that the side effects are a big downside, where the side effects of good sleep are a huge upside in movement. So yeah, I think there's plenty of good stuff to go around.
Yeah, I love that. It's like very, not only low cost, but there really is you have nothing to lose. It's not like, oh, you might overdose on a supplement and you might get, a certain, illness or like a deficiency or whatever. And I feel like in lifestyle medicine, it's like move more, sleep more, all these things that really are a no-brainer. And it's something that doing them is not gonna, it has no side effects. Or
the side effects are huge.
Yeah.
Oh, it's anti-cancer. It's and by the way, we're decreasing your risk for stroke and heart attack. Excellent.
Exactly.
I
love that.
Yeah.
I love that. So what do you think is the role of doctor and healthcare professional health and well-being in lifestyle medicine? Like I feel like that's one of the things that get left out in conventional medicine, is like actually talking about the physician and healthcare professional health. Like how can doctors and healthcare professionals be kind of like a role model for their patients? And why does lifestyle medicine start with them?
That's I love that. At first, because I thought you were talking about what is our role. And we mentioned before, our role is sort of a guide, as a, we're here to guide and assist, not put the finger out and point and say, see you 3 months, by the time you should have all this stuff taken care of, and good luck with that. Mm-hmm. But as far as a role model, that I think is very exciting. I've had multiple patients straight in my face say, I would not listen to anybody else, but you look healthy. And I'm like, great. I'm glad I look healthy, because hopefully I'm, walking the walk and talking the talk, but I can understand that. I mean, if you're, think of anything else that you're going to be, paying for or trusting somebody with, and you don't see them doing the same thing, it's a hard sell. It's very challenging. The cool thing is that when we as healthcare professionals are caring for ourselves, we are better at what we do. Fill in the blank. We're better husbands and wives. We're better, children or parents. We're better doctors. We get sued less. And that's a big deal here in the United States, all the legal aspects. When I'm in relationship with my patient, they know I'm here for them. It's a very powerful tool when they trust me, and I can see it. I love watch you guys that are listening, watch for this. I love this. It's one of my favorite things. It usually is on the second visit with a patient. And I have a little bit more time with my patients than typical physicians here in the United States because of the practice, the way that I set up my practice. But patients come in, and especially if they've been through a lot of, bad healthcare experiences or whatever, and they're just they're tense or what have you. And we'll start talking, and all of a sudden I watch their shoulders, and they go like this. And their shoulders just I call it this, the shoulder sign. They go like this, and they sit back a little bit. I have got their trust. They now feel like I'm on their side, et cetera. And so we can have a lot more effective communication. I can tell they trust me, and they will ask me questions. They won't leave and go, I don't know what the heck she was talking about. They'll say, well, wait, why would I do this instead of this? Good question. Let's talk about that. Because then they're going to be able to follow through that much more. So I think role model means a lot. I think it's obviously, you exuding health. And that doesn't mean you have to be at a perfect weight, because I think you can be healthy and be overweight. Now, obese is a different story. I'll be very honest, because obesity is tough. There's a lot of things that happen in the body, but you can also be a work in progress. As long as you're exuding that to the patient. Say, I had a patient today, and I always say perfect is evil. I hate perfect, because you start driving for perfect and you're going to make yourself very frustrated, and you're going to feel like you're always not quite there. And so I really personally do not believe in perfect. And he was struggling, and we were talking about setting new goals, and he's like, I've set these goals before. I'm like, that's okay. And I started laughing. I said, if you had another half an hour, I could start telling you my issues. I said, I got plenty. So I think being human, and that's our humanness, we're never perfect, and we never want to represent ourselves as, I got all my stuff going on, and I'm just here to kind of check you on yours. And you don't have to share personal things with patients. I'm not, you don't need to break down to that level, but I think you need to respect and understand them and say, I get you, I hear you, and here's how we can, plan on this together. Here's how, does this make sense to you? Can we meet you where you are? And then we can walk from that. So I think, again, being a role model is good, but you also can open up your struggles. I'm actually chairing the first American Academy of Family Practice, which is a big AFP. It's a big entity for family medicine doctors here in the United States. And they have their first lifestyle medicine conference for AFP members, which is so significant. And part of that, as a chair, we're going to get up, the three of us, and we're going to talk about our struggles in lifestyle medicine. As practitioners, it's not like you have everybody lines up and says, boy, your diabetes is controlled within a month and yours is, all my patients are great success stories. That's not human. That's not our experience, but it's a shifting, and it's a guiding, and it's, knowing that you're coming from a place of knowledge and understanding and good training, that you can get up and do this for patients day after day, and know that you're really getting the most out of your role as a healthcare professional.
Yeah.
I told Laura, I said, I'm a talker. You're gonna have to.
No, that's incredible. That's amazing. Thank you so much. Okay. So yeah, definitely. Yeah, I totally agree with the fact that it's not like a linear kind of thing. Like, oh, you're going to go into lifestyle medicine and suddenly all your patients are going to start reversing their illnesses and all these things. I think that it's kind of like a bit like you get some highs and then you get some lows. And I think that's more realistic, because some people think that once they adopt this kind of like new modality in medicine, lifestyle medicine, which is people hear the word reversal and it's kind of like, what do you mean? Because they all their life in medical school, they were taught that diabetes is like, type 2 diabetes is like a death sentence. And like,
right.
If you have heart disease, like your only options are taking statins for the rest of your life and getting a bypass or a stent. So I feel like just, it must be so comforting for people to listen to this message, and from a practitioner like you that has so many years under her belt, like practicing lifestyle medicine, hearing this and the humility behind your practice. And it's not a game of like trying to like, oh, like I reverse diabetes or whatever, like all these chronic illnesses from these kinds of patients. It's like being there for your patients and kind of like showing up as a human. And I think that that's one of the most important things in lifestyle medicine, the humanity. Like you bring back humanity in medicine, and it's not just like, oh, 15 minutes to diagnose and prescribe and you're out the door.
Yeah. Ding, ding, ding. I got the right the game, give me 50 points. I'm gone. Yeah. It's not.
Yeah.
You were spot on.
Definitely. So you are a member of, how long have you been a member of ACLM, or how long have you since you started in contact with them?
It's funny. Somebody asked me that question before, and I'm like, I'm going to get this wrong. Mm-hmm. But I was there at one of the earlier maybe 2012. Well, I can't remember. Or one of the earlier ones when it was maybe 500 people there. And so it wasn't the first or second year, but it was about 500 people there. And I was like, oh my gosh, I found my people. I found my home. This is so cool. I was just thrilled at hearing the lectures and thrilled at talking to the people. And it was a much more intimate group. And I've gone every year since to ACLM, and I got certified through ABLM in 2017, I believe it was. And it's, it's been an incredible journey. And that I have, you not only are you getting that professional backing of knowing that you're learning all this stuff and it's pertinent to everybody. So it's not like I'm learning this small subspecialty that I can only use on certain patients and then knowing that I can help influence a lot of my community here, because I'd love to say that everybody here, I'm in Cincinnati, Ohio, understands lifestyle medicine. Absolutely not. So not only do I love going and being part of the large national ACLM and international communities, but I know I've got a lot of work right here to come back and help people understand what that means and how it's done and the impact that it can have, which is just tremendous. It is very, very exciting. But so I've been involved with ACLM for a long time, but it's still very fresh and invigorating. I so look forward to the conferences every year. It's just, and I've heard some of the speakers speak, multiple times, get something out of every single time that I hear them speak. And again, I actually, I can't remember what it was. I'm not great at dates at all. It just is kind of one great big journey. But years ago, I was in charge of the conference and, trying to oversee, the speakers and who was coming. And that was a great honor to start to understand how broad this is and how many people are really doing some strong work and similar work in different areas of the country. So you just know you've got something really good when it's picking up in, all these different areas. And then again, and to continue to watch it, I'd say grow internationally, but what's really fun is a lot of people have been trying to do something very similar. And now we've got a home and a name and a movement to attach to, because we all know this is the right thing to do. And I used to think, I'm like, this is what family medicine does. This is what primary care does. And then when I started understanding it, I'm like, this is what we need to be doing, but this is not what we're trained to do very well at all. So that's why I think there's a huge, absolute need for the lifestyle medicine. I mean, absolute transformational, or otherwise what we would be doing would already be helping with all of the, the non-communicable diseases and the diseases that are just having such a profound impact, which was, I think, highlighted by the COVID pandemic. I mean, we just saw the vulnerability of people and health and systems.
Yeah, definitely. I think that if we, and you saw, I mean, it was not hard to see the numbers. I mean, for example, Mexico was very affected by, and the US as well, we were very affected by COVID, particularly because we have high rates of obesity, of chronic disease, and very high rates of diabetes, heart disease, all these things that make you more vulnerable. So I feel like if you take a look at countries that were not as affected in terms of chronic disease, you really did see a difference in how they received the pandemic and the outcomes and the deaths and all these things. I feel like we as North American countries, like we were really not prepared for a global pandemic in this sense. I feel like maybe if somebody would have I don't know, mentioned the fact that lifestyle medicine and implementing healthier habits can help, maybe more people would have adopted a healthy lifestyle. But unfortunately, by the time that COVID struck, it was too late for some people. Obviously, I think that it's never really too late unless it's like really, I don't know, like a really bad diagnosis. But yeah, I feel like it's always a good time to start implementing lifestyle medicine.
Absolutely. I think, again, we are sitting here now, like you said, the North American countries, high rates of obesity, high rates of communicable disease, non-communicable diseases. And we just went through this pandemic and it was like profound. Oh my gosh, we are so vulnerable. And that's by choice. We don't have to be that vulnerable. How awesome is it to give that message that you can take control? People can take control of their health destiny in their own hands. It's not like, oh my gosh, I have to pay $10,000 to go to this doctor or $20,000 to go here, or, I have to go find somebody to be able to do this for me. It's you need a partner, you need a support, you need, an environment around you, you need the knowledge, you need somebody help you because we didn't get here living, let's say a 37-year-old or a 62-year-old all of a sudden be like, oh, I got all these diseases. We did behaviors to get here. But the really cool thing is to know that then you can now take it into your own hands, again, hopefully under the guidance of someone well trained in lifestyle medicine, and say, now my destiny and my future, because guess what? This is probably not the last huge pandemic last huge hit. And oh my goodness, how I want to, and again, it's not saying I'm fireproof. I'm not able to withstand anything, but my resiliency is going to go here. So if I do happen to get sick, or if I do even happen to get that cancer, my body's just charged and juiced and ready to go to be able to fight that and to resolve the disease and then to carry on, with other modalities, et cetera. So I think, again, one of the best things we can do in lifestyle medicine is amplify this message, especially now, and to say that, yes, this was devastating. And guess what? It didn't have to be for so many different reasons. And if we can become a healthier nation, a healthier population, a healthier globally, then we are going to be able to do that much better, to be there for others. Because we are also, that's the one thing that I think it taught a lot of us is we're so interdependent. You can't live in this world without being affected or infected, for lack of a better term, by all of us around us. So
100%. And I'm really glad that this movement of lifestyle medicine is spreading, and that it's here at the Mexican Association of Lifestyle Medicine. We've been around for about 2 years, and we had our first conference last year in November, and we're going to have our second one this year in November. We're very excited about that. It's the first weekend of November. And it's just starting in Mexico. And what's one thing that, one piece of advice that you would give to us as an organization, or people that just want to adopt lifestyle medicine into their practice, to fast track the adoption of lifestyle medicine in our country?
Wow. That's a great question. I would say we'll start at an individual level. So for individual practitioners in Mexico, I would lean in. One thing that we have that is very valuable is our resources and our time and attention. So where you put those, make sure it's meaningful. So if you're doing other things in your career that you're like, this is just in there, lean into lifestyle medicine, help the organization, help the movement locally in your own community, talk about it, have seminars, have, like I do a full plate living class, invite people to different educational things. Not that you're going to, again, you have boundaries, you can only do so much, but what you can do, there's just a lot of satisfaction and joy in practicing this way. It really does pump you up. So I'd say from an individual level, learn more, support the organization, but lean in even in your local area, talk about it. Then from an organizational perspective, I would look, influential partners. Look for the people that are going to be aligned with you. Look for those that have the same key initiatives, whether it be global, like earthly health, because what's good for us beautifully is good for the earth. So as we're finding more and more understanding about sustainable living, most of that is actually very healthy for us. So, finding those partners and getting the message out, amplifying. There's so many people, once I expose them to this, they're like, oh my gosh, this is brilliant. This is so simple, but this is brilliant. I'm like, I'm like, why have I never heard about this? Why has my other doctors never talked to me about this? Yeah. It's just that exposure and making sure that you're, connecting in. And then again, one of our biggest things in ACLM is education, really trying to get into every level of the education. I am so proud of the people that I work with. I'm on the board of the Lifestyle Medicine as well. And they have taken through ACLM and Susan and the whole crew over there and with coordination of the board, we now have, I believe it's over 83 LMRCs, which is the residency curriculum where lifestyle medicine is in residency programs. We're going to be going for the same number of fellowship programs. They're now in undergraduate medical education. I want to say there's also 80 something. And again, I might remember my 80s or something, somewhere right around there, lifestyle medicine interest groups. Wow. So whatever you're doing, wherever you are, do your lifestyle medicine thing. And you'd be amazed once you light your candle and shine it and how much then that starts to glow and other people start picking it up. So I'd say where you guys are, and then come together as a group, come to the conference if you can. I know it's always been a challenge, but there's something beautiful that happens when we're together, and we really, the synergy that happens when we're like-minded people together. So I would say those, areas, and that's what I've experienced myself.
Yeah, definitely. Last year at our conference, we were about 130 people, and it was plain like COVID. We decided to go through with it anyway, because we were in an outdoor location. So by November, it all started like calming down, and like it wasn't so bad. Then it got bad again in December and January, but November was kind of like a sweet spot where things were kind of like chilled out. And it was really magical. Like the people that went, like we were all just blown away by how everything was just, I don't know, so beautifully orchestrated, and like the speakers, and there was so much synergy and so much connection that I feel like a lot of us were missing from the pandemic and being isolated for so long. Definitely we embodied the part of connection in lifestyle medicine in the conference. So I would definitely say that is one of the most important things as well. Okay.
Yes.
So one of the other things that I want to ask you is that, what do you think are the next steps for ACLM as an organization?
Well, they're super busy. Boy, they they are reinvesting all that time and energy. The growth has been just so much fun to watch. Yeah. So I think, they're going to continue to really focus on the education part. We've been, I think, beautifully successful in pushing that agenda right already with all the success we've had. But we're building on that. And it's great, because once it catches fire, you just have to keep feeding it, because then you're like, well, they did it. Yeah, they did it. They did it successfully. They are doing this. Oh, okay. Well, then I know them. It's just, it's beautiful once you get to a certain level, and then that continues to grow. So, doubling down on the education efforts, continuing, CME events, CE events, reaching people that don't really understand lifestyle medicine, but also the other stakeholders. And they now have a corporate roundtable with companies. And if you think about it here in the United States, who pays for healthcare? It's really individuals and then companies. Because the government really doesn't pay. The government is a pass-through. We give money to the government, and the government passes through. So everybody, we think of the government as a big payer of healthcare. They are, but they're really transactionally just a pass-through. Mm-hmm. So the influencers, the people that really should be thinking about where we're spending our money in healthcare, should be the companies, and as us individuals, as taxpayers, and people putting into the greater pot. So what's been really fun is to bring in the employers and the large corporations into the space, saying, this is one of your biggest expenses, is healthcare of your employees. How would you like to use lifestyle medicine? And once they understand lifestyle medicine, they're blown away. They're like, oh my gosh, this is so aligned with what they want to do. Whereas maybe other industries like insurance companies or hospitals or pharma, which are in healthcare, they're not as aligned financially as an employer might be. So I think, again, the corporate roundtable has been a great addition. And same with the Health Council. We're also working with larger healthcare systems, because they're really understanding their call to the community is improved outcomes at potentially a lower cost. Have never seen it better done than in lifestyle medicine ever. So again, it's just obvious once we get those connections in there. So I think the biggest thing for ACLM is continue with the education, but then really start, and we're looking a lot into what does this mean to identify and help design clinical practice, so we can do this routinely on a regular basis. And that has to do with payment, because as we're all doing a job, we need to get paid appropriately, and lifestyle medicine takes time. And so how are we being paid appropriately and fairly, not fairly, it's a hard word, but appropriately for, what we're bringing to the table as well-trained, highly trained lifestyle medicine, who are getting the outcomes, who are helping people be healthier. So I think we're really putting a lot of effort into working on that. And then there's been a lot in the HEAL space, which is a health equity for all, because lifestyle medicine shouldn't be for people who can only be at a certain level. We all need lifestyle medicine. So there's a lot going on.
Yeah. There's
Good
a lot
stuff
going on. And I heard a little bit about it. I was listening to a podcast with Dr. Michael Clapper in Ridgeville, where he was talking about like educating the next generation of doctors. And and how they're actually like getting into, you know, medical schools and putting lifestyle medicine questions on the medical exams and all these things that you have to like actually knock on doors. And it's not something, I mean, the medical schools are not going to come to you. Like we have to like go to them and like kind of like demand that they change, that they add a lifestyle medicine to the curriculum. So that's definitely something that we want to model after ACLM in the future, definitely.
Yes. And again, we've been knocking and learn from what's working. And again, and that's what's so fun about staying in connection globally, you know, what's happening in your area, what's really working there. But yeah, I think that's key, is really understanding those foundational pieces.
I love that. Okay. So now for the final question, before we go into a short Q&A, is what is the future of lifestyle medicine as a whole, and what can we do to join those efforts?
Well, I think it's what we already discussed a little bit, is amplification. Yeah. It's taking this message. I think the message is sound. I think the science is sound. We're still doing a lot in research. Lots of money is going to research. So even though we're like, okay, this makes sense, it works, but continuing to double down on the research, understanding, you know, from case studies to, you know, new research. So I think building a body of evidence, and that doesn't have to be done, you know, it's applicable to many populations. So sharing in that research, but then I think it's, again, the amplification, coming together and saying, hey, how can we amplify this message? Who are we going to get this to? There's, I know the state of New York, the governor there, it's been so super exciting because he's Whole Foods Plant Strong, and Michelle McMacken. Eric, you know, Eric, and Michelle McMacken is right there by his side, and she's a brilliant physician, kind of helping guide, you know, influencing in a very strong way with science. Yeah. So with no political agenda. I mean, she's just there to serve, and it's beautiful. So again, finding partners who really get it and who are in places to help us amplify and spread that message. That's amazing. Yeah. I feel like getting into public policy is one of the best ways to spread lifestyle medicine, because we can sit here and talk about lifestyle medicine all we want, but unless someone is doing something legislative about it, like people are going to continue to eat the same things. They're going to serve the same things in lunch. I saw he was changing the menus on Fridays to plant-based, which I heard that there was like kind of like a bit of a resistance by people, and it blows my mind, like how people can be like, let kids eat what they want, and like they were protesting the fact that one day a week they're going to be eating plant, like that was, it blew my mind. And still, like, and you know what's really funny? If nobody said anything and they just started serving plant-based, it wouldn't be any big deal. I mean, it wouldn't be that big of a deal, but because somebody had to come out and say it. And I think some of the best ways, and again, to all the people who are practicing, look in your own practice. If, you know, I find that there's CEOs in my practice, and then, you know, after I get to know them, instead of, I'll get the chance to say, you know, what are you doing in your company for this? And like, well, what do you mean? I'm like, you're paying for healthcare and your benefits, you know, what would you, and then it's like, oh, why don't you come talk? And I talk, but again, I personally, I find that talking doesn't change people. I'm like, how about if we run a program in your, in your company? How about if, you know, we were able to do, et cetera, et cetera. And when you have somebody stand up, like, you know, let's say a senator went plant-based, and they're like, and they look fantastic and they feel vibrant, and people are like, oh, I want some of that. So there's a difference of, you know, leading by example. And I think more and more people in leadership roles can lead by example, kind of to go back to our first start about being a role model, that is exciting. And then things just kind of happen. Yeah. I love that. But we also have to work at it. You know, I agree with you with policy. We have to be very thoughtful and intentional what we're doing and who's influencing that policy. And why? Yeah, that's definitely something to look out for. So, okay, Dr. Mechley, thank you so much. If anybody has questions, you can put them in the chat, or I'm gonna allow people to. Yeah, and you guys can ask me videos, and unmute yourselves if you want. If somebody, like, you can just literally like unmute yourself and ask a question. You can ask me anything, personal, professional, national, international, board. Yeah, take advantage of Dr. Mechley here. Like, just take it as the fact of the opportunity that you have right now to ask all of your questions. You know, like you said, it's a hard time of the day right now. We're like in the middle of the work day. Definitely. And I think Everybody's kind of doing their thing, which is good. I would say, remember to take care of yourselves.
Yeah. Because
like Laura, we talked about before, being that role model and making sure that as a physician, you're taking time out, going for a walk. We have a meeting every other Tuesday, and we start with it's just a 3-minute breathing exercise, and it shifts the energy of the room. It's so nice. And then we're all focused, we're all present. Yeah. So nobody has any questions. This is unusual, but yeah. Laura, your questions were so good.
A shy audience. It's okay. It happens sometimes. If anybody has any questions afterward, I'm going to send the recording to our mailing list after, and all the people that registered. And if anybody has any questions, I'll forward them to you, so that you can answer them.
Yeah. Yeah, feel free. Well, I love the intention that you guys actually are putting forth. And I know, this, like you said, you're in growing stages, but I've been through multiple growing stages in my own career where, you're showing up and you're the first few people, and then it goes and goes and goes. And I can tell you, by being involved in lifestyle medicine, you guys are on fire. I mean, this is just where it's at. I've gotten just so much, I don't know what the right word is, attention, but they're like, what are you doing? I mean, I love when physicians, I used to do as a medical director, I used to do programs and stuff. And other physicians are like, what did you do to my patient? Like they're off 3 or 4 medicines. What's going on? And it was just a great entry into, hey, this is what lifestyle medicine is. Yeah.
That's incredible. Yeah. A lot of people just don't understand the concept, and it's kind of like mind blowing. The fact that you don't need to depend on medications for the rest of your life, like many people are told, and it's just something beautiful to see. And I can imagine, I mean, I'm not a physician or healthcare professional myself, but I've seen it in people that they start lifestyle medicine, and the spark starts again in their eyes, and in a way, they're like, wow, my patients are getting better again. And I remember a quote from Dr. McDougall that said, I'm the happiest doctor in the world because my patients get well. And I feel like a lot of doctors don't experience that because they just keep prescribing and prescribing and prescribing. And I feel like they don't have a chance to ever get well. Oh, we have a question. Lorena is asking, okay, how to convince meat eaters to switch to plant-based on some meals, at least, without them getting defensive?
Yeah, it's a great question because so a lot of times, well, again, it depends. I hate that answer, but it depends. It depends on where you are in relationship with them and where you are, if you're meeting them for the first time, or if you're, you've been with them for a while. I usually tell them I don't tell them not to do something. It's always coming in the positive. And I'll just talk about, usually picking up on their why, like if they were just sick, if there's something else going on. And then I say, hey, let's talk about your nutrition. What are you eating? And if so I'll give you examples. It's summertime. I love to grill out. So I'm doing my steaks, I'm doing my burgers, And I'd be like, oh, I'm feeling, I've been feeling kind of sluggish, et cetera, et cetera. Huh. And so you're just, using that motivational interview to kind of bring them into where you're at. And then you'd say, or the easiest discussion was if your cholesterol, you got your LDL sitting up there and you're like, let me tell you where this LDL comes from. And so they start to understand that your body makes its own cholesterol. But then in addition to that, you're adding in all this other cholesterol that's coming from this animal. And you and I just agreed that your LDL is too high. So what is the one thing that you can do to possibly bring that out? And they're like, well, if it's coming from the animals, then what are you telling me? You want me to be vegan? I get that all the time. You want me to be vegan? I'm like, oh no, because I'm like, you can do Diet Coke and Doritos and be vegan. I want you to be nourished. I want you to eat, So then I'll say, let's try to crowd out with fruits and vegetables. So I kind of switch that to how many fruits and vegetables you're eating, what kind of things do you like to eat, blah, 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 blah. Well, what I would love for you to do is eat more. And then people kind of look at me like, because most doctors don't tell people to eat more. And I want you to eat more of these kind of foods, fruits and vegetables, whole grains, et cetera. So after, it's not a quick answer because you just kind of have to figure out where they are, but it can be very efficient. So you can do this and that's one of the things I teach in my programs is for physicians, you can do this in a very efficient way by asking the right questions in motivational interview and finding out what their why is. And then saying let's set a goal today. What is one thing you think you can do? Well, doc, it's a really good point. I'd probably like to eat, you say 2 fruits and vegetables a day. Let's bring that up to 4. And I'm like, that's a great idea. I let them set their goal. I don't say, I want you to eat 5 fruits and 5 vegetables. Which ones do you want to eat? you can go to 4. Or if they're having a hard time setting their goal, I'll say, how many fruits and vegetables do you think you can eat tomorrow? Because, and they're like, well, tomorrow's my work day, Well, I can do 5. I'm like, great, that's awesome. Okay, so I'm writing that down. 5 fruits and vegetables per day. How do you think you're going to do it? Just go through your SMART goals. Well, I'm going to do that. Okay, how are you going to record that? Great, blah, 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 blah. All right, let's do this. How long do you think you can do it? Well, I think I can do it for a month. Super. We're going to talk again in a month. And your goal that you just set was to eat 5 fruits and vegetables. And we want to be really specific. So you think you can do bananas, raspberries, and you don't want to list them all out, but you're going to add these things because these are the things that are easy to pack in your lunch or what have you. And you know how to buy them in the store, et cetera. Great. And you're going to do this for this long and you're going to write it down. You're going to check back in with me. And I'm like, that's awesome. That is your goal. I said, if you go above that, that's fine. I'm not going to be upset. I said, but that was your goal. That's your minimum goal. And you just think you can do that. And so I make sure they agree twice, because it's not like I just talked them into it. I'm like, and I reiterate it back to them, and then they come back in, and then eventually I'll, the whole meat eaters, kind of switching to more plant-based, you just keep crowding out. So that's one technique that I really like to use, because if you start really eating a lot more fruits and vegetables and grains, you're just not going to have a lot of room for meat. And then if there's a real good reason for them to go from meat to plant, like your LDL cholesterol, or you just had a heart attack, then you can start showing them a little bit, or talking to them a little bit about sort of like what the game changers talk about is the inflammation part of it. When you eat this kind of protein, it comes in and you have got a greater amount of inflammation in your body. And you just told me you have a really hard time getting down on the floor with your grandkids, and that arthritis or that pain you feel in your joints or the muscle aches that you feel, some of that has to do with inflammation. So what are other ways of like reducing inflammation in your body? A lot of it, and one of my sayings is the biggest lever you can pull is nutrition. You can try this, you can try that. I think that's great. Or we can, do this. But which one, if the biggest lever you can pull is changing nutrition, do you want to start there? And they're like, oh yeah, I want to do the most effective. So again, what I'm just kind of babbling through is a lot of motivational interviewing techniques of just getting people to where they can kind of see that they're making their own goals or making their own decisions. And it's not, all in one, because I'll laugh at them and I'll say, for 2 weeks, you can say, that's it. I'm doing grapefruit, avocado, and blah, 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 blah. And I'm not doing anything else. And I said, it's going to last about 10 days. And then you're going to say, I hate this. I can't live like this. And then you'll stop. So again, we talk about shifting and not going really big. But if you've got somebody there that just got out of the hospital and had, serious heart disease, et cetera, then food is a prescription, and then you're going to be much more prescriptive. So I love Brenda Ray as a physician. And I love how she talks about it. She's got this chronic disease continuum and the dose continuum. So if you're at prevention, your doses don't have to be so strong. But when you're over here at chronic disease reversal or treatment, your doses are going to be stronger. And so you can kind of decide how to think about that prescription for nutrition or switching from meat to other things. And I usually, again, don't do absolutes. I don't say you can never eat another piece of meat in your life. That never, whatever, I just say, where do you want to start and where do you want to go? I hope that answered the question, because that's a big question and it's variable.
Yeah, no, definitely. That's a fantastic answer. I feel like using the positive aspects instead of using the negative aspects of like, oh, eating meat will give you this. I feel like it's better to talk about like, oh, if you eat plants, like you will get these benefits and you will have more energy and all these things. I feel like people get more convinced by that than by listening to the negative, because I feel like, people know all these things. People know that they eat soda and chips and a lot of animal protein. Like it's no secret that I mean, at this point, it's no secret that that's detrimental to health. But I feel like people are more convinced in a way by the benefits.
Absolutely, yeah. And set their own goals.
Yeah, I love that too. I feel like people feel more committed if they set their own goals, as opposed to having someone else set their own goals for them, because then it feels like homework and it feels like something somebody else told me to do instead of something that they committed to. I feel like that's so powerful. I love that.
Well, it's like anything else, like, oh, that was my idea. Good idea. I love that idea, And then when they come back, you're like, look what you did. Look what you did. You created that idea and you did it. That's exciting. And it builds on the next one, because you got to think of this as a continuum. It's not just a one-shot thing. It's saying, okay, now I'm going to build on that. It's fantastic.
Incredible advice. Thank you so much. Okay. Lorena has another question. What are some basic supplements that you prescribe to your patients?
So I'm not a huge fan of supplements like we talked about. I think, getting most of our nutrients from foods is important. Walter Longo has some really good information, I think, on vitamins that makes sense to me. And he talks about if we're really, really good, all of us can't get the exact nutrients that our body needs, and our body's in different phases. So he talks about a really high quality or good multivitamin, and they don't have to be expensive. If you really look at some of the vitamins, a good multivitamin like every 3 days, kind of fill in the gaps, because there's certain magnesium is sometimes challenging to get, and other things. So that's one. Vitamin D is one that I think is tends to be important for most people. It's challenging to keep your vitamin D levels up, especially in the States here, in some of the areas when it's darker in the winter and we're not out and about as much. So I think checking vitamin D levels and possibly using a supplement for that. It's somewhat limited. There's some that I like to do for people under stress, like B vitamins, especially for women under stress. Magnesium can be helpful for different types of magnesium for sleep. So other things are more specific to maybe some concerns. In general, I don't have a big regimen like people always ask me about, zinc, CoQ10, and I haven't found personally that I think there's some good science for certain areas, but I haven't found it to be consistent. And I always think it's tricky to go to, where the studies show, yes, you can find it in your bloodstream, but you really find it at the cellular level, where we know that food really does get in at the cellular level. So I take that. It's fun because people will ask me that a lot. They'll come from, and I like chiropractors. There's nothing wrong with chiropractors, but a lot of chiropractors in this area, they prescribe a lot of supplements, certain types of chiropractors and other health people, allied health people in those areas. And they'll come with like a shoebox of supplements. And they're like, I want your opinion on these. And I'm like, you're not going to like my opinion because I would rather you eat, tomatoes and oranges and cucumbers and green beans, et cetera. So it's a great opening conversation for food and how we absorb food. When patients come and talk about a lot of supplements in my mind. So yeah, I don't in my practice personally prescribe a lot. My partner was originally trained in integrative medicine. And that's another area, integrative medicine, where there's a lot more supplements. And she found as we practiced together that she's definitely had less and less and very similar to the way that we both practice now together. So Lorena, I hope that answered your question. Not many, not many supplements. But again, if there's specific disease states, other issues, if somebody has ulcerative colitis, there's certain probiotics that I think are extremely important. If somebody's just been on antibiotics for a while, I think certain probiotics can be very helpful. So different disease or conditions, but not as a general rule.
Okay, fantastic. Okay, so yeah, using food as a primary means of nutrition is great. Yeah.
I just know, again, it's designed beautifully. I mean, think about it. Nitrogen, oxygen, carbon, we're the same as food. Those are our same elements. And so it just makes sense to, in a lot of ways to use that as our main source.
Amazing. I love that so much.
Especially for our kids.
Yeah. Definitely. Thank you so much, Dr. Mechley, for your time and for all your wisdom. I'm sure a lot of people the people that are here are going to definitely apply this knowledge, and the people that get to see the recording this will come in very, very, very handy. So thank you so much for taking the time to chat with us today.
It was absolutely my pleasure. Absolutely my pleasure. And Laura, thank you so much I love what you guys are doing. I looked back at a lot of the speakers you've had, you brilliant people. There's so many wonderful people in this movement. So yeah, tap into all of us, and we're all definitely in this together.
Thank you. Thank you so much. Yes, we are. And I'm sure we will be talking again sometime very soon.
That would be lovely.
Thank you so
that would
much.
Be lovely.
Have
all right,
a lovely
guys.
afternoon.
Take care.
Everyone.
You too.
Bye.
Bye.